Morning, Barbados, good morning. Wake up, wake up, wake up. Morning to you.
6:25, that's our time, and we're moving forward. Our Dr. Andrew Ford is in with us. He is our dermatologist, and it's Tuesday, so we're going to get some helpful assistance. Today, we're talking about something that is not familiar. It may sound familiar, but I really am not sure what this is all about. Dental sinus. So, Dr. Andrew Ford, good morning to you.
Good morning, Cassandra.
Good
and
to
Doug.
see you.
Good morning. I
Yeah.
just see y'all got the memo.
We're flanking.
Yeah,
flanking you with
But it
Brilliant
complements,
blue, yeah.
yeah, your lovely bow tie with the penguins.
Oh.
Yeah, just sharing the details that I know you can't see.
gotta
But
learn how to tie one of those.
Me too.
Dr. Ford, what is this situation, this
Condition.
Thank you, Doug.
I thought I'd talk about something that would be easy to pronounce for everyone.
Thanks.
Yeah, right on that
Very
score.
considerate. Yeah, well, dental refers to the teeth, and a sinus is a connection, a canal that connects two surfaces in the skin, either internal and external. So dental sinus actually speaks about a condition where an infection in the tooth through a canal can lead to the skin surface, and this usually occurs on the face or in the neck. Very often, dental abscesses can lead inside the mouth, but for dermatological purposes, the external manifestations are important. And you see this nodule on the chin of this lady, and that would have been an area that would drain inflammation or be tender or hurt. And that actually is a connection between her infected tooth and the outside of the skin. So this just shows you the carious or infected tooth
This
area.
person doesn't look very old.
No, that's a young person. So it doesn't happen often. It's very uncommon because when you get an abscess, it usually hurts a lot. But if you can get a relief and a decompression of the abscess through the tissues inside the jaw, then it can reach the surface of the skin.
I would never think that there could ever be a connection
at all.
between
When
the
you
teeth
see that.
and the skin.
Yeah, most of the time the person's in so much pain they go to the dentist, but when the pain is relieved, you know, you can have an infection of the pulp of the tooth or a gum infection or a bone infection, and this is a way of that infection relieving itself once it's a path of very low resistance.
So this is a good and a bad thing, or this doesn't look very good at all?
Well, yeah, just showing you that, I mean, the teeth in the lower jaw, the mandibular teeth, are the ones which are more common for this, and this is another similar inflamed area. So because it appears on the skin, it can be misdiagnosed for lots of other things, a simple acne cyst, or as people would say, a pimple or an abscess or
worm.
something else. We talked about a pyogenic granuloma. But the fact that it remains there and keeps and is very persistent, even though you may get treatment via some antibiotics or some other treatment, should make you think about the dental sinus.
So this can't be, what would you call it, sliced and drained?
Well, that's what most people would do. Most doctors would just look at it, be unaware that it's a dental sinus, try to incise it or drain it. You just end up causing the patient to have more scarring, or maybe a puckered scar instead, because if you don't make the connection between where the origin of the infection is and what's seen on the skin, then you will be a bit frustrated, and the patient will keep returning. It isn't very common. I mean, in over 20 years, I've seen maybe 2 dental sinuses. It doesn't happen often because in most cases it just stays either in the mouth or it opens into the mouth.
Okay, Doug. Okay, where are you going, Doug?
Don't worry with that question, Doug.
No, I'm just kind of curious though. What, you know, you've only seen 2, you know, in your professional career. The first time you saw it, what did you think it was?
Dental sinus, yeah, a great memory. That's the beauty of a great memory.
What about this, and why does it always cause this dimpling appearance?
Well, that's a scarring artifact. But in this case, the infected tooth is in the maxillary area or the upper teeth. So in this case, it can open close to the nose, or it can open somewhere on the cheek. So the opening of the sinus is determined by where the infected tooth is. So, but of course, this form is not very common. The lower teeth would be a more common area of infection
So
for
how
this
do
manifestation.
you really treat this, and would going to the dentist for regular checkups stave this off?
Well, certainly, unless the infection. Sometimes you can have an infected tooth and the tooth itself looks fine, You could have had a trauma and have a crack there that it isn't very obvious, or you could have had a prosthesis or an implant which got infected. So this just goes to show that where the infection is, if you take an X-ray, you can see a lighter area under that tooth with the white or opaque area, and that's where the abscess is. So when you knock the tooth, sometimes it can feel tender, or you can feel this sensation of cold. So if you also want to make the diagnosis, in some cases you can actually put a probe through the opening of the sinus, and it leads back to the tooth that's involved. But an X-ray is a simple way of making the diagnosis other than clinical know-how. And certainly in that case, you have to remove the tooth that's infected. And that's a simple resolution. But if you just try to make incisions into the skin or cut things out, then you're going to end up with a problem.
Okay. All right. So, and treatment is?
Yeah, antibiotics, removing the tooth, and it will resolve in a few weeks.
Okay. Okay. All right. Sometimes some interesting things happen. Not often do they distract me.
Beyond the scenes.
It just
But
happens.
I mean, can you still eat and drink and so on normally?
Yes, you can, because in most cases it's painless because of the relief. So the person is unaware of what's happening, and they continue with their daily activities. But it's just having this area that doesn't heal on the chin or the neck or the cheeks. That's what really causes someone to get some attention.
Okay.
All right, Dr. Andrew Ford.
Wow.
Great stuff. I never thought of this. I may have
Nor
seen this
did
condition.
I.
And
I never would connect.
dental sinus.
Yeah.
You got me there. You should. I would have preferred the big name that I couldn't pronounce. This is this kind of
Thanks
scary.
for
but good.
sharing. I like that you bring these things to light. So maybe people just don't understand and think they have a bad bump or
Yes.
something, and they're seeing this. So you shed some light on this. Thank you so very much, Dr. Andrew Ford. He's our dermatologist as we focus on getting into my skin, helping you understand it a little bit better. Up next, we're going to tell you all about that healthy holiday